Hello, my name is Enos and welcome back to the channel. This is Work and Wonder. On this channel, we talk a lot about the mental health nursing OSCE. So if you're a nurse, you're a mental health nurse out there, and you are preparing for your mental health nursing OSCE, this is the right channel for you. This is the only channel that talks about the mental health nursing OSCE. So over the last couple of weeks, I've had a lot of emails, people asking me about the changes that has been done to the general OSCE, whether there were anything that really affected the mental health nursing OSCE. So this is a video that I'll be talking about the changes that did affect the mental health nursing OSCE. When you go to the adult nursing, there was, removal of some things in their API, but we are not adult nurses, we are mental health nurses, so we're going to look at the things that are relevant to the mental health nursing OSCE. In terms of the mental health nursing OSCE, there wasn't much changes. The only changes that did happen was the professional values and then the evidence base, which you know that it cuts across. So whether you are doing adult nursing or you are doing mental health, the professional values and the evidence base is the same. So what they have basically done is that they have taken some of the topics out. When you start to prepare for your mental health nursing OSCE and you look at the 15 topics and then of both professional values and then the evidence base, you are like, how do I learn all these 15 topics, knowing very well that you only be examined on one? So now they've removed some of them. So the number of topics that you have to study for both professional values and evidence base has reduced. Let's start off with the professional values. Let's look at the topics that were taken out. Concealment of birth status is now out, and then confidentiality is also out. False representation is out, and then professional confrontation is also out. So these are the 4 topics that has been taken out of the professional value. So as it stands now, the topics that you would be examined on is 1. Bullying, 2. Drug error, 3. Falsifying timesheets, 4. Hospital food, 5. Falsifying observations, 5. Impaired performance, 6. Laboratory results, 7. Possible abuse, 8. Racism, 9. Social media, and then 10. Witness abuse. So these are the topics that you'll be examining on. So from now on, if you are studying, make sure that these are the topics that you study, and I'll leave a link in the description which will lead you to the updated marking criteria where these topics that I did mention have been taken off. Now let's look at the evidence-based practice as well. The evidence-based practice, only 2 of them were taken out, which is the cranberry in association with UTI and then autism. These are the 2 topics that has been taken out. So as it stands now, you would be examined on ankle sprain, bedside handover, cervical screening, dementia, diabetes, female myocardial infarction symptoms, fever in children, pressure, ulcer prevention, restraint, saline versus tap water, smoking cessation, honey dressing for venous legs. So these are the topics that you'll be examining on, and then the 2 have been taken out. Or at least now the topics has been reduced, so which means that you have less to read now for your professional values and then your evidence-based and then the evidence-based practice. So that is just basically the changes. I have gone through the whole marking criteria, and one thing I have noticed is that they have not changed anything in API, they have not changed anything in the skill station as well, but I have noticed that some of the marking criteria, some of the writings have been reworded to make more meaning. When you look at the old marking criteria and then you compare to the new one, some of them, the statement that they put there was quite blank, but now they have reworded some of them, and then it makes a lot of sense. And when you are reading, it tells you specifically what is expected of you. So this time around, if you go and then you fail, you wouldn't blame that I didn't understand this statement in the marking criteria. Now, most of them is very, very, very clear, and then they've reworded them. Some of them, they've put them in brackets to even, tell you what they mean in general. So this, I will leave the link to the updated marking criteria, and then the timing, all the supporting documents that you need in order to prepare for this, your mental health nursing OSCE. I'm going to leave the link below. Just click on it, click on mental health, and then you can see all the various relevant documents that you need to prepare for your mental health nursing OSCE. In addition to this, I'll also leave the link to my API booklet, my skill booklet, and then the care plan booklet also in the description. When you click on it, you also have access to it, as well as I'm also going to leave the link to the WhatsApp group. This is a group that I've created. It has over 200 people there who are all preparing for their mental health nursing OSCE, and we only discuss mental health nursing OSCE related things on the page. People do put questions on, you get answers to them. People that have passed are still on the page, and you can ask them any question that you want to ask them, and then they are more than willing to to answer some of these questions. And then we also share very relevant materials on that particular page. Once a while I also do come online or come live, and then I do answer any questions that you may have in regards to the mental health nursing OSCE. If you are new here, please make sure you subscribe to the channel, you turn on the post notification bell, and anytime I upload a video, you'll be notified and you will come straight here and take a look at the video. This has been the video for today. My name is Enos, and until I see you again in my next video, it is a bye for now.